I'm Lloyd Miner, Dean of the Stanford University School of Medicine. I'm joined today by Dr. Tate Shanafelt, a nationally recognized expert in physician wellness, who joined Stanford Medicine 2 years ago as Chief Wellness Officer. Tate, I'm delighted to have the opportunity to discuss our paper, Healing the Professional Culture of Medicine, that will appear in the August 2019 edition of Mayo Clinic Proceedings. I'd also like to recognize our co-authors, Edgar Schein, Mickey Trockel, Peter Schein, and Daryl Kirsch, for their contributions to our findings about culture and physician wellness. Tate, healthcare organizations have been addressing the critical issue of physician wellness in many ways. Can you share what our paper shows in terms of the source of this challenge?
So I think we've begun to understand some of the drivers of physician wellness, and much of that work has focused on characteristics of the electronic health record, new regulations, less time with patients, and an excessive amount of work spilling over into home life. But in many ways, these are symptoms of more fundamental problems with our system. And what we, I think, have begun to learn is that some of the characteristics of our healthcare system are incongruent with the fundamental altruistic values of the profession.
So one of the major findings of the paper is the misalignment between stated values of healthcare organizations and actual organizational behavior. Can you dive into this more and show how it affects our physicians?
Right. So I think when we see incongruence between our behavior and what we claim we stand for, it can create cynicism for physicians. Some examples would be that as organizations or a healthcare delivery system, we claim to prioritize the needs of patients, to be committed to social justice and fair distribution of resources, but we then deploy organizational approaches that limit access to care based on ability to pay. We also claim that physicians are a valued resource, that they're highly trained, that we should maximize use of their time, and that they should be trusted. But then we have requirements for excessive documentation to justify billing codes, insurance pre-authorizations for tests, and overburden physicians with a great amount of low-value clerical work.
Physician-focused strategies are improving physician wellness, but our research showed that getting to the bottom of this issue requires holistic culture change. How does this happen, and what does it look like?
Well, I think it begins by commitment from leaders. They need to both articulate what a future better state would look like and be authentically dedicated to leading the organization there or leading the profession there. But we also often then need to empower divisions, departments, small groups to try working in a different way. And that can then make the change a little bit less threatening and also allow them to see the path and feel like they can be successful in navigating that new approach. And that leads me to a question for you, Lloyd. You have insight into this about how do we as leaders commit to change and sometimes the fear that leaders experience when they realize fundamental changes are needed. What insights do you have having navigated those types of challenges?
Well, I think the first thing is that as a leader, we have to build the trust and confidence of those who have given us the privilege to lead. And that means being honest. It means facing dilemmas and realities that perhaps we'd rather not have to deal with. And it also means building an inclusive culture of problem solving and decision making. It can't come from just a small group of leaders. Really, to effectively change culture, everyone in the organization has to be engaged in and ultimately committed to culture change.
As a leader of an academic medical center, how do you think the results of this perspective, this manuscript, will help or assist the journey of other academic medical centers and their leaders?
We're all in this together, and I think this article and many others that you have published on the topic gives other organizations, as well as our own organization, a toolkit that can be used to approach the manifestations of burnout. One size won't fit all, but there are some general principles related to the culture of wellness, the work environment, and also the individuals input to and desire to achieve wellness and well-being, those are going to have many similarities across multiple organizations. Tate, what are the future areas of research related to physician wellness?
I think there's still much we need to learn, and increasingly the work that needs to be done is evaluation of system-based interventions to improve workflows, reduce low-value work, improve teamwork, increase flexibility and control for physicians, and to help them reconnect with some of the meaning and purpose in their work, as well as reconnect with their colleagues. And we need a variety of organizations testing and experimenting with different approaches and then sharing that knowledge with other organizations. And I think it is going to be a bit of trying different approaches and seeing what works and then scaling and disseminating those approaches. I think there's also a need, and thankfully there's recognition of the need to bring about some change at a national level through some evolution of regulatory approaches, some reform in the way pre-authorizations are implemented, improvement in our electronic health records, and different approaches to documentation assistance, team-based care that can also allow physicians and other healthcare professionals refocus their energy and attention on taking care of patients and meeting their needs. And so I think hopefully that is the direction the science and the field will evolve.
Thank you, Tate, for your time today and for leading the work on our paper, Healing the Professional Culture of Medicine. Physician wellness remains something that we need to continue to address. And thanks to the work of you and our colleagues on this paper, we now have a better understanding of the underlying causes of wellness. Now, hopefully, we will see a better support system for patient care providers that instills the joy of medicine into their everyday work and improves outcomes for patients. Thank you.
Thanks, Lloyd.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.